the spread of COVID-19 to protect our communities. Right now, it is important to wash your hands often, get tested if you have symptoms, stay 6 feet away from other people, wear a mask when you go out, stay home when you can,
अपनी नुकसान है नहीं है कोई डेली का करना चाहिए ठीक नहीं है डेली मैं तो कह रहा था एक दिन छोड़ के 2 दिन छोड़
हम फोन लगे
क्या कर रहा हूँ
पानी नहीं गिरा बस 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 थोड़े से आलू से भिजवा दे थोड़े से चुने हैं बारात आ रही है कहाँ कहाँ आ रही
अरे यहाँ पे हो रहा है दुकान में
शादी हो रही
During a large infectious disease outbreak, a lot of people can get sick as a virus spreads easily from person to person. The virus spreads in droplets when a person who is sick coughs or sneezes. Being close to other people makes it easier to catch the virus. All of us can avoid spreading or getting viruses during a large outbreak by practicing social distancing, which means staying at least 6 feet away from other people. Stay away from busy places where many people are gathered too. Because viruses can be more dangerous for people who are old or have medical conditions such as heart disease and diabetes, it's especially important to practice social distancing so seniors and people who have a weak immune system don't get sick. The best way to help yourself and help others is to stay home as much as possible and practice social distancing whenever you do have to go out. You can also keep yourself and your family safe by staying home if you are sick, avoiding people who are sick, avoiding events or large gatherings. During a large infectious disease outbreak or pandemic, health officials might require businesses to close temporarily to slow the spread of illness. Events like concerts, public gatherings, and faith-based activities may be canceled for a while to help people avoid crowds. But even during a pandemic, grocery stores, pharmacies, and the post office will stay open so people can buy food, medicine, and supplies. Some businesses, like restaurants, have a drive-through, walk-up service, or delivery, so there are a variety of places for people to shop without going inside. If you need to go inside a grocery store or pharmacy, stay at least 6 feet away from other people. Buy only what you and your family need. There will be plenty of supplies. Families are asked to keep a 2-week supply of food and medicines on hand. Take the bus or train only if you can't get there by driving or walking. If you must take public transportation, leave 6 feet of space between yourself and other people. If the bus or train is full, wait for the next trip. If you must take public transportation, wash your hands often, cover your coughs and sneezes, and try to avoid touching your face. Do not take public transit if you are sick. Avoid visiting people who are sick or who are at a higher risk of becoming sick. Doing so helps everyone stay as healthy as possible. And remember, stay at home if you are sick. Wash your hands often and cover your cough. There are many kinds of diseases you can get from other people. For most people, most of the time, these diseases aren't a big threat to your health. But sometimes, the diseases or viruses you get from other people can make you very sick, or even threaten your life. Sometimes these viruses can spread rapidly from one person to the next, affecting whole families or entire communities. That's called an outbreak. Sometimes doctors can use medicine or give people shots to stop the spread of a dangerous disease. But there are other times when medicine or shots aren't available to stop the spread of an outbreak. By changing some of your routines, you can help keep yourself and others from getting sick. When someone is sick, health officials may ask them to practice isolation to help slow the spread of a dangerous disease. Isolation means the sick person is asked to stay home and separate themselves from other people, including those living in their home if they can. The person may be asked to practice home isolation by setting up a sick room, which is a space where they can rest alone without spreading any potential illness to their family. Always follow your doctor's advice before you end home isolation. If the sick person is in the hospital, he or she could be put in a special isolation room. The doctors and nurses and people who come to visit might need to wear special protective clothing. During an outbreak, there will also be some people who are asked to stay home because they could become sick. That's called quarantine. If a person is in contact with someone who was sick, health officials will ask them to avoid contact with other people by staying home and not having visitors. If your clinic recommends quarantine, you should begin immediately. After 2 weeks of quarantine, call your clinic or local health department and ask if you can stop quarantine. While people are staying at home, health workers will check on them to be sure quarantine guidelines are being followed and families have the supplies they need. If you are caring for someone who is sick, limit contact, wash hands often, avoid touching eyes, nose, and mouth, and clean surfaces that are touched regularly. If possible, wear a face mask if one is available. For some families with only one bathroom or many generations living together, it can be difficult to establish a sick room or use a separate bathroom. If possible, have the sick person use a separate bathroom. If you must share a bedroom or bathroom, clean all surfaces every day with cleaning products. Be sure to clean phones, furniture, countertops, sinks, toilets, and faucets. Wash bed covers often. You can end home isolation or quarantine if your clinic says you can, and you have no fever for 3 days. And your symptoms improve, and at least 7 days have passed since your first symptoms. For more information about isolation, quarantine, and caring for someone who It's normal to feel sad, anxious, and even angry during a crisis, like a natural disaster, a violent crime, or a disease outbreak. Everyone Everyone reacts differently to stress caused by a crisis. Your culture, age, and family situation can all affect your reaction. You must pay attention to your physical health as well as your thoughts, feelings, and actions. It's also important to pay attention to the thoughts, feelings, and actions of others in your community. Some signs of stress are feelings of disbelief, anxiety, or fear. Sleeping too much or not enough. Eating too much or not enough. Not being able to concentrate. Feeling irritable or angry. Physical reactions like headaches, stomach aches, and skin rashes. Increased use of alcohol, tobacco, or other drugs. Young children returning to behaviors they have outgrown. When you take care of your own stress first, you can provide the best support for your community. Here are 5 ways to take care of yourself during a crisis. 1. Watch less news. Only get your information from reliable sources. 2. Make a plan. Have enough food and medicine for 2 weeks in case you need to stay at home during a difficult time. 3. Take care of your body. Take deep breaths, eat healthy foods, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. 4. Find time for activities that make you happy. For example, read a book, take a walk in the park, or watch a funny movie. 5. Talk to the people you love. Use phone or email if you don't live in the same household. Stress can make some people become angry, violent, or abuse alcohol and drugs. If you or someone you know is in danger of harming themselves or someone else, talk to a spiritual leader, elder, the police, or a counselor. There is also free help available from the Disaster Distress Helpline, 1-800-985-5990.
I wear a mask because
I wear a mask because I can, but my baby can't. Do it for their futures.
We must slow the spread of COVID-19 to protect our communities. Right now, it is important to wash your hands often, get tested if you have symptoms, stay 6 feet away from other people, wear a mask when you go out, stay home when you can, and work from home when able. Thank you for doing your part. Stay safe, Minnesota.
आज का है वो खत्म
खत्म यार तुम्हें बता ही देते हम और मंगवा लेते
और ले आऊँगा लोग
ले आओ जाओ चले जाओ तो
अब कहाँ जाऊँगा
अभी टाइम थोड़ी हुआ ज़्यादा
एक मिनट
इसमें तो क्या होगा इसमें कुछ भी नहीं हुआ दो पैकेट तो पिए बोले नहीं
आप तो बिली
आप क्या हो रहा है आपने दो पैकेट तो पिए आपसे क्या करना